Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everybody, it's Tom Viola from Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. So we're going to continue in our discussion of antibacterial agents, and we're going to talk about two agents today that don't really get a lot of use in dentistry, but are, I would say, valuable adjuncts in our quest for antibacterial activity in treating dental infection. And of course, the first agent we're going to talk about is metronidazole. Now, metronidazole, also known by its brand name Flagyl, is bactericidal, meaning it kills the bacteria by disrupting the DNA, causes the bacterial DNA to lose structure. Again, bactericidal may be great if you're killing the bad bugs, but bactericidal also means you kill the good guys too. So you can expect to have some adverse effects from metronidazole. Well, then why use it? What's the point? Okay. Amoxicillin, our favorite friend in dentistry, has great coverage, but one thing it lacks is significant coverage against gram-negative anaerobes. Well, metronidazole may not do very well against the bugs that amoxicillin can cover, but it does do a good job against those wascally gram-negative anaerobes. So, you see where we're going here, right? I've got amoxicillin that does a good job, but doesn't cover all the bugs. I've got this other drug, metronidazole, that doesn't cover a lot of bugs, but covers the ones I need. Let's use them together. And again, that's synergy. So the synergistic effect of using both the amoxicillin and metronidazole together means you get coverage against everything you need, right? Both gram-positive and gram-negative. For years, metronidazole was always looked at as the drug to treat more of those exotic infections, like amoebic infections, protozoal infections, trichomonal infections. But it's got great coverage against gram-negative, which is why we love it in dentistry. Now, having said all that, remember that metronidazole does have some nasty adverse effects, mostly GI distress. And what I mean by that, I mean, yikes, pretty significant bad taste in your mouth, kind of like a metallic taste. And it can actually cause the infamous black hairy tongue, or of course staining of the papillae. The greatest concern in the use of metronidazole is the potential for the interaction with alcohol. Metronidazole, when combined with alcohol, can cause projectile vomiting, profuse vomiting, which is rather intense and quite uncomfortable for the patient, and it can persist for quite a while. So if your doc, if you are to be prescribing metronidazole, make sure you remember to tell your patient absolutely no alcohol. Now, of course, most times people think we mean no ingestion of alcohol, but there have been some cases that I've seen where patients who use metronidazole couldn't really even tolerate the alcohol in a mouth rinse or the alcohol even in certain perfumes and even hairspray. So keep in mind that it's other forms of alcohol that may be problematic with our friend metronidazole. I thought you were going to talk about two agents, Viola. Well, it's always good to have cliffhangers. So the next episode, coming up right away, will be on our discussion of the macrolides. Until then, my friends, this is Tom Viola saying be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.